When you come and see an osteopath here at the Good Health Centre, you'll be going through a few stages. The first stage is taking the case history. Now at the Good Health Centre, we take a case history in great detail, and there's a reason for that. The first part of the case history you'll be describing your pain, your discomfort, and the onset of the pain, and so forth. But the second part of the case history taking will be in relation to your general health, and there's a reason for that. After you've done the case history with the questioning of your general health and your presenting symptoms, we will go into an examination. The examination will be a full neurological, full orthopedic assessment, and then we'll give you the osteopathic assessment. Following the osteopathic assessment, we then come up with a diagnosis. The diagnosis is made out of the combination of the detailed case history, the detailed examination, the osteopathic evaluation, and then you come up to the diagnosis itself. So after the diagnosis, we come up with a treatment plan. The treatment plan is based on all the factors that were described before. So to give an example, if you come for instance and you have tension headaches, you might present just with tension headaches. By having taken a detailed case history, we can find out, for instance, they are worse in the morning or worse at night. They might be associated with work opposite a computer. They might be associated with the fact that you had a whiplash 10 years ago. They might be associated with your personality, being a very tense person, giving rise to headaches. All this information is very important for us, and it starts to build the clinical picture of the person with a headache as opposed to just a headache. Bearing in mind the case history, the examination and osteopathic examination, we can come much closer to the real diagnosis of why the person has got a headache. When it comes to the treatment, the main aim of the osteopath is to what is the best treatment at this moment in time to give you the maximum benefit. It's important to recognize there's a person with a headache as opposed to just a headache. So for example, if somebody comes and they're very tense and as a result of tension they have headache, the treatment might be very different from somebody who, for instance, just needs ergonomic advice and being aware of where is the computer on the desk when they come to workstation, for instance. Having acquired all the knowledge from the case history and the examination, we start to build a proper clinical picture. This will make a big difference as far as what treatment is most appropriate for you at this moment in time. With certain patients, just changing the pillow and being aware of sleeping habits will do the trick. With other patients, relaxation techniques, reducing the tension in the shoulders will do the trick. And other patients might require addressing the whiplash pattern they experienced 10 years ago to do the trick. Hence, a very careful case history and a full examination brings the right treatment for that patient.